Hey there, and welcome. I'm Anna Hartman, and this is Unreal Results, a podcast where I help you get better outcomes and gain the confidence that you can help anyone, even the most complex cases. Join me as I teach about the influence of the visceral organs and the nervous system on movement, pain, and injuries, all while shifting the paradigm of what whole body assessment and treatment really looks like. I'm glad you're here. Let's dive in. Hello. Welcome back to another episode of the Unreal Results podcast. As you might imagine, doing a podcast every week for the last 2-3 years. Has it been 3 years? I don't know. Let's look. I'm like, it feels like it, but also I started it in, the end of the year 2022, like literally the last week of 2022. So this was 1, 2. Oh, this is the third full year. What? That's amazing. Actually, I didn't realize that. So yeah. The end of this month will be the 3-year anniversary of the Unreal Results podcast. I mean, I wasn't intending to even celebrate that, but can we get a second? That's pretty amazing. There's some crazy stats. I don't even know what the stats are, but the amount of people who podcast, how many podcasts there are, and the amount of people who continue past episode 10 is a very, very tiny percentage. Actually, in our business mastermind this past month, Jill Coleman, my business coach, aka Jill Fit, she shared with us the data, and it was wait, what? It was kind of crazy. I'm actually looking through my notes now because I was do I have it? Maybe not. No, I don't know where it's at. I could Google it. Let's do that. Actually, I'm pausing. Be right back. All right. Well, I'm back. I didn't even Google it. I ChatGPT'd it. So whether or not this is even accurate or not, hard to know. Is well over 4 million plus individual shows. But it says nearly half of all podcasts produce 3 or fewer episodes, which is kind of wild. And the data is not perfect, but some things cite the amount of people who make it to 50 episodes is only 8% of that. And honestly, Jill's data was even less, and I've heard less by many takers too. At the end of the day, it doesn't really matter. Because we're not in the business of comparing ourselves to others. And then also, I know it's not very many, and it's still, podcast land is still growing. Podcasts are still a really great business thing. And people love them. People consume them. They're easy to I think that's partly why it's easy to consume. It's easy to consume from a long format education piece. So regardless of what the world does, I'm pretty stoked to have made it 3 years fairly consistently. Obviously, I take time off because life. I take time off sometimes in the summer. I take time off when I'm sick. I take time off when I need rest. So on average, I try to put out an episode every week. I think the first year I had 42 episodes. The next year I had about the same, maybe 50. I had about 49 episodes the following year. This year I've had about 52, 54. So I've been a little bit more consistent this year. Anyways, though, I'm super proud. of making it a priority, and I love hearing from you all. By far, people who come to my in-person courses tell me that they found me, or at least if they didn't found me from the podcast, they started listening to the podcast and became obsessed and then had to come to the courses, which I love. And I love that it is a podcast that you find helpful and you're obsessed with. And, you know, I was a little hesitant of like, what can I teach without like videos and without, not that this isn't a video, but you know what I mean, like educational tutorial videos and like an actual lecture. And turns out a lot. And also I think it's just nice to have a place to have a real general clinical conversation, especially, you know, I think I've shared in the last couple podcasts, I'm currently onboarding 17 people in this year's Revitalize Mentorship Program. And this is the first year I've had the mentorship back in 2 years. So I had taken a break from it to sort of redesign the path through Movement Rev education, or to redesign the mentorship, to like really focus on what I wanted to do, how I could best support clinicians, practitioners going through the mentorship. And because really the mentorship was what started this whole education piece of Movement Rev back in 2019. And so, you know, it was the thing for a while. And then I pulled the locator test assessment protocol out of it, made it its own course, because realized that is the foundation of what I need people to understand. It is the foundation of assessment. It is the foundation of how I talk about cases, because when anybody asks me about a case, the first question I want to ask is, well, where did the body direct you? Because I hope you're learning through this podcast is it doesn't matter if it's knee pain, or it doesn't matter if it's shoulder pain, it doesn't matter if it's back pain. Every shoulder pain, every back pain, every knee pain is different per the person in front of you. And then even every iteration of back pain or injury in that patient is different on any given day, because that is just how the body works. And but yeah, we made that the foundation because I wanted everyone to appreciate the wisdom of the body in guiding us through figuring out where to start our treatment. Because what has happened in the industry, and this is kind of like where I want to go with this podcast episode, is we are not at a lack for tools and treatment techniques. So many tools and treatment techniques out there. I mean, everything we learn is designed around that. And it's sort of like, I remember when I was first learning from Philip Beach, his one of the things he talks about is like the relationship between your feet and low back pain, and specifically your feet as sensory organisms and low back pain. And one of the things he said is like, over the years, we know more ways to treat the back. We have more tools, more modalities, more treatment techniques, arguably even more assessments, but still not that many. Well, if we have the assessments, people are not always doing them. But he was just pointing out, like, we have all this knowledge, and yet it's still like the number one thing and the most debilitating thing that happens to people. And like, despite all this knowledge, we're still not being successful in actually helping people. And that's kind of the same thing of what I find as I'm speaking to people, is so many of us have so many skills. Like I have practitioners that come to my courses that have 20 plus years of experience, 15, 8, 10, like I get seasoned professionals with so many treatment tools come to the courses and still kind of not know how to put it all together and feel a little overwhelmed. And then also when it goes to our confidence, this is a big piece, whether people talk about it at all, but it's like we gather more tools and treatment techniques because we want to do better for our patients, and because there's a fundamental lack of confidence in ourselves to be able to get the result for people, because we constantly feel like we're missing something. It's been an interesting journey for me as I speak to what the LTAP offers, and I speak to this confidence piece, and I speak to this need for less treatments and more integration and understanding, and an assessment tool like the LTAP that listens to the body. And I think back, and even with even with me being a learn-it-all, I love learning. That that's a term that Craig Liebenson says a lot, which I think is so good. Not he's like, don't be a know-it-all, be a learn-it-all. 100%. However, and I love learning. People ask me what my hobby is, and honestly, until I started going whale watching years ago and actually have a hobby, whale watching and wildlife photography, marine wildlife photography, yes. My hobby was continuing education and learning. And I mean, it still is. Like I said, I love to learn. But what I've noticed is over the years, as I've really leaned into the assessment and really leaned into not just any assessment, but an assessment that honors the wisdom of the body and allows the body to guide me where to treat, and really lean into what it means to be trusting the body in front of me to give me the answers that I need, and trusting my body to feel those answers, to feel things, and also honor that is the most accurate, truthful thing there is, because we are sensory beings. The more I've leaned into that, and I've had to since I've been teaching this, right? When you think you know something, you got to teach it, and then you realize you don't know it as well as you thought, and it it helps you to learn it even better. So over the years of teaching, I've leaned into it even more, of trusting the wisdom of the body and really validating what I'm teaching other people. And what I've noticed in my own continuing education journey is I actually do less courses than I used to. And at first I thought it was the nature of two things. Number one, the nature of just being tired. Number two, the nature of I was teaching so much, I just felt like my cognitive bandwidth was lower to take on more information. But as I really sit with it, and I'll get messages from friends of mine that are love to learn too, and also doing a lot of the Baral Institute classes, and they're like, oh, Anna, what courses are you taking this year? Let's go to the same course so we can be lab partners, which is great, by the way. They've got all these courses on their list, and they're like, what courses are you taking? And I'm like, I don't have any on my calendar this year, or I haven't even thought about it this year. And that is such a strikingly different scenario than me 5 years ago, 3 years ago, definitely 10 years ago, definitely 20 years ago. I was the person who took 10 to 12 continuing education courses a year. I spent easily minimum 25 grand, probably closer to 50 grand when you include all the travel and stuff, on my continuing education every year for my whole career. And so yeah, I've been reflecting on that lately, and I'm thinking, honestly, because I am much more content now, and not just content, it's not like, again, like I don't know it all. There's still so much to learn, and I love to learn, and I will continue to learn. But my confidence, I'm like way more confident than I ever was, and like a true confidence, like not an egotistical one, like a true confidence in terms of like, I have seen how amazing the results are when you can trust the body, lean into the wisdom of the body and the body's ability to heal itself, and come at it from a calm, regulated nervous system perspective. And I really feel like the results do come easy. Are there certain patients that take me more sessions than I would like, or are, quote unquote, harder than the others? Of course, that's the nature of it. That's the nature of it. One, humans, the humanness of it, and then both for the clinician, or both for the patient and myself, the clinician. I would be lying if I told you that I come to every patient session like fully regulated in my nervous system and taking care of myself and not stressed out and not exhausted and like being able to reap the benefits of that. Like, no, not at all. Not at all. But I have been in it enough and witnessed it enough that I recognize when one thing is the problem versus the other, versus feeling like I don't have enough techniques and treatment tools to get results. So it's really interesting. I really didn't realize that until like the last month or so, maybe longer, but like I really didn't like think about it of like, oh yeah, I'm taking less and less courses nowadays, not because I don't want to continue to learn. And just because I'm not taking courses, doesn't mean I'm not learning. Like we've talked before, I tell you every day that I read anatomy and look at anatomy, and that is no lie. I'm constantly learning. I've got hundreds of books that I could easily pull off the shelf and learn something from. Like, you don't actually have to go to a course always to be learning, right? But yeah, there is less of a drive for me to go get more treatment tools and more techniques because I've got so many of them already. And I also have witnessed that when you're in the right spot, when you're in the area where the body wants you to be and can tap into the body's ability to heal itself and change, like it doesn't have to be that complicated and complex. So those are kind of my thoughts. But so what, the roundabout way, land the plane, Anna. I was like, yeah, just thinking about, what do I want to talk about? Because as I started up this podcast telling you, it's been 3 years, every week for the most part. And that is exhausting to figure out what to talk about every week. A lot of the times I talk about my cases. I talk about questions that come up in the courses, just whatever I'm dealing with in my own body. And, but sometimes I'm like, I don't know what to talk about. And so the other day if you're not on ChatGPT or some sort of AI, LLM, I don't know, the learning language model, what are you doing? It is the future, whether you like it or not. And it is super helpful for the most part. So I've been using it quite a bit to actually, like, I feel like it's just as a solo, I don't want to say solopreneur because I have people who work for me in my business, shout out Ariel and Lex, and Joe, but also, I'm still like working for myself, sort of. I use ChatGPT a lot as like someone, it's not a human, it's math, as a way to get out what's in my head and have a conversation about it, to like filter out what I want to say, what I want to do, some like bigger picture ideas. So anyways, the other day I had like fed it all the episodes of the podcast. How many episodes is that? This will be like number 142. So I fed it like 140 episodes, and I was like, hey, here, granted, it's just episode titles and stuff, but I was like, here's the episodes I've done over the last 3 years. You know, I don't even know what I prompted it with. It might have just been like, any ideas for next episodes? And oh my gosh. Yeah, future podcast episodes. I'm pulling it up here. I said, hey, here's a list of podcast episodes. Please brainstorm some future episodes. I gave it 141 episodes, and it says, here are 40 plus fresh episode ideas organized by theme, fully aligned with the movement, rev, whole organism paradigm, LTAP messaging, and the kind of case conversations your audience loves. And oh my gosh, it did like spit out how many? 55 episodes. And I like looked through them and I'm like, man, and then series, and like, I was like, man, this is really good. This is not one of them. And then today I gave it just this year's episodes, and I said, hey, just curious, do you see like a theme that kind of came out of this year's episodes? You know, just because I was kind of curious just how it went. And it broke down that this year we had 4 dominant themes that ran all year. So I'm going to share those with you. And then we're going to talk a little bit more about one. So it said the 4 dominant sub-themes that ran all year. The problem isn't the pain, it's the paradigm. A huge portion of the episodes directly or indirectly challenge the orthopedic only tissue isolated mindset. Well, duh. That is the purpose of the podcast, right? Like, my whole intention with this podcast always has been all about exposing you to how the viscera and the nervous system influence the biomechanics and musculoskeletal system. So it should be a theme. Another theme was the nervous system as a hidden driver of biomechanics. And I'm like, yeah, yes. But continue. Like, again, it's part of the main theme. The other theme that came out of this year was the viscera are already in the room, whether you acknowledge them or not. So it says you normalize visceral influence without making it weird. But yes, exactly. Like we had a whole episode even on that. And I'll have Joe link in the show notes, but it was like, you're already treating the viscera, you just don't know it. Like, at the end of the day, that is like what I'm also trying to point out to people, that we have always been whole organism. We just haven't been assessing and treating in that thought process. When we are assessing and treating into the traditional paradigm, we're assessing the musculoskeletal system, the orthopedics, the biomechanics, and treating that way. And with that said, we have always been the whole organism. We are a whole. We have never been parts. And so getting you to appreciate the viscera and the nervous system and the wholeness of ourselves allows you more treatment options, allows you bigger picture, bigger ideas, seeing connections. So that is a main theme. And this goes back to, too, like I get a lot of people asking me on the internet, like, oh, are these courses teaching me visceral manipulation? And I'm like, no, they're actually not at all. I might teach like a technique here and there that I learned in the Burrell Institute that I was just like so good I can't not teach you. But at the end of the day, I'm not teaching their work. I love their work. I will be a champion of their work until the day I die. And I will push people to learn those techniques because they are very valuable. But I'm not teaching them. And also, like, why would I? Like, why recreate the wheel? What I'm good at is assimilating all this information together and making it make sense. Big picture. And so that, that's a big part of it. The fourth piece was, or sub theme was, assessment creates freedom, not complexity. And this is what I wanted this podcast episode to kind of be about, though. Now we're like 20 something minutes in and I've kind of just been rambling, shocker, but I'll land the plane with this for sure. But I loved that. Assessment creates freedom, not complexity. It says this might be the quiet hero theme of the year. Better assessment doesn't make practice harder. It makes treatment lighter, faster, and more honest. I was like, ooh, Chatty G. I couldn't have said it better myself. And like, that is so good. And that has always been my theme. Even when I was just operating in a biomechanical musculoskeletal paradigm, I've always been big on assessment and like knowing that the more time you spend in assessment, the better the chance you have of picking the more appropriate tool and applying it in the quote unquote right place to get the better results. And then of course it said the human layer, this kind of overlying all these subdomains like woven throughout the year, alumni interviews showing confidence replacing overwhelm, episodes on self-compassion, hopelessness to hope, conversations about raising the bar without burning out, stories of various different practitioners. So the underlying message that the locator test assessment protocol and the whole organism approach isn't just changing outcomes, it's also changing how clinicians feel in their work. Which is what I'm most excited about. I love it. It says, if you want a clean wrap-up statement for the episode, this year on the Unreal Results podcast was about moving from force to finesse, from chasing symptoms to understanding systems, from feeling overwhelmed by complexity to trusting a clear clinical roadmap that respects the whole organism. Now, forget all that Chatty G talk, even though I'm like, gosh, it really... Sometimes when I read back it's writing sometimes, especially it's writing around summarizing things I've said to it. I'm like, ooh, you've got a way with words. I was like, okay, does that mean my love language is words of affirmation? Possibly. But anyways, back to this assessment creates freedom, not complexity. I think sometimes when it comes to assessment and previously, an assessment that didn't have a piece like the locator test assessment protocol to direct us where to go, assessment felt, especially in a traditional treatment setting, like a waste of time. Because it didn't adequately always tell you where to start. And it seemed like a lot of the treatment tools or techniques that you were doing were like, biased on a paradigm's idea of it all starts in the core, it all starts in the feet, or it all starts in the hip and pelvic floor. Like, we've all probably operated in those paradigms before. So it's like, why do this full assessment if I'm going to start with breathing with everybody? Why not just start with breathing with everybody and go from there? And so I think we sort of pulled away from a thorough assessment, because we didn't feel like it gave us clarity, and we didn't feel like it helped us figure out where to start, and we didn't feel like it gave us any extra valuable information to sort of like really determine what we were going to do. And this is, again, going back to the mentorship, as I talk to the clinicians who've been through the LTAP and who still want, who've seen the magic of the LTAP. And like, once you kind of see it start working, you're like, ooh, I really want to lean into this and make it even better. And when it comes to making it even better, it's all about getting even deeper with our assessment. And I believe I did a whole episode about this that I'll have Joe link in the show notes, because I talked about like precision and specificity with our assessment and our treatment, and how like if you have a really precise, specific treatment tool or technique and you're using it with just kind of a general assessment, you're going to get like kind of actually bad results. It's better to have a general treatment tool at that point. And so it's like, if you want to learn higher level treatment tools and techniques and have them work for you, you need to have an assessment that matches it. And so what we're talking about, with the LTAP alumni is like, okay, yeah, so the LTAP has directed you to the central nervous system. So now what? Like, okay, you can do some general stuff in the central nervous system, which can be helpful sometimes. But if you have the tools, right, if you've taken the Burrell neural manipulation, or you've taken craniosacral, or you've taken some massage courses, or like things that like have skills around the cranium, or even the rest of the central nervous system, the spine, like if you know how to evaluate the spine better, if you know how to evaluate the peripheral and central neurodynamics and differentiate neurodynamic tension between the two, like this is when you use those assessments. So it's like once the body's directed you like, oh, it's central nervous system, then you want to use your other assessments to get more specific. Because if I can determine like, oh, it is the ophthalmic branch of the trigeminal nerve on the right side, this is where I need to go. Or it's the cerebellum, or it's the T6 area of the spinal column, or it's the tailbone itself, or it's like definitely central from a neurodynamic standpoint with my double leg slump test. All of these, like the more we can narrow it in, the easier we can pick the right tool for it. And so, I'll continue to lean into this messaging that the assessment creates freedom, not complexity. It should make a good assessment should make treatment lighter, faster, and more honest. And that is really like how we continue to like get better and better results, So in the courses, I show this graph that Chatty G helped me make of this like idea of this assessment precision and specificity, and the treatment precision and specificity. And it's like, this is how we move the needle from getting the industry standard results right now, which is like 60% success rates at like 8 months of rehab, to closer to 100% success rate at less than 5 treatments total. I'm always like, I guarantee results in 1 to 3 visits. And I feel like I get close to, if not 100% success rates. And, I've done episodes on that I can have Joe link in the show notes, but this is how it happens. It's just this assessment specificity, because this assessment creates so much freedom. And then where you go from there and what treatment tools you pick. And this is like the cool part too, is because, as a clinician with years under their belt, like me, we're like gathered a lot along the way. It can feel overwhelming, and it can feel like, man, where do we start? How does this fit in? And like, we just have so much. And so it just brings some clarity of like when to pull those tools in. And it does make treatment lighter, faster, more fun. So this is yes, it seemed like, according to Chatty G, that this was a theme for the podcast episodes this year. And it will continue to be a theme, because this is what gets the results. And even, again, as I talk to all the people that go to the mentorship has like 100 hours of continued education, not on the LTAP, on like other parts of working with human beings, the theory, the, movement assessments, all the stuff. I don't want to say old stuff because it's not old, but like there's so much more to learn, right? But the emphasis is actually not that at all. There's always time to learn all that information. The emphasis is the integration of the work and continuing to narrow the assessment, and also taking care of yourself so you can come at it calmly, so you can trust your own body, so you can trust what you feel, and trust the wisdom of the body that's in front of you. So anyways, I'm sure that this episode had some coherence in it, but it is like, it's just a chatty episode, thinking about reflecting. Tis the season to reflect. But yeah, I'm grateful for you being here. I'm grateful for you listening and enjoying the podcast. And as a little Christmas gift, if you haven't already done a review, left a review, rated it. I don't think I've ever asked for that. And I guess 3 years of podcasting, sure, that would be great. I would really appreciate that. But we got 2 weeks after this podcast. We got 2 weeks left in the year, or 3 weeks left in the year, and I'll have some new episodes for you. I have a guest coming on probably next week, and then we'll do a couple solo episodes more than likely. So hope all is well, and we'll talk to you next time.